Well, one of the treatment strategies I also going to tell at TEN is that we need to avoid opioids. We are all aware of the opioid crisis in the US, but we did actually a study in the Netherlands where we looked at the opioid use in the Netherlands, and we were quite shocked that also in Holland 13% of the migraine patients ever used opioids, and some of them even use it as preventive medication. 2% of these opioid users, they took it from their relatives or their neighbor or whatever. It was not even prescribed. So this means that we're not handling our migraine patients or headache patients carefully enough. So we have to explain it to them more carefully, and we need to provide our migraine patients with more and better prophylactic treatments. In Holland, if a person has medication overuse headache, and luckily most of them, they have no opioid overuse, so they're overusing normal painkillers or triptans, and we withdraw them from this medication acutely. It's an outpatient way, and we provide them with some behavioral advice given by our headache nurse, and it's really, really very effective. And we also did a study which was initiated by our own Leiden headache group, where we compared this acute withdrawal with providing also Botox treatment. And there was no proof. This was a randomized clinical blinded trial, and it showed that the acute withdrawal was so effective, there was no additional effect on providing them also with botulinum toxin A. And this is now currently a huge debate in the world, because people find it quite difficult that you have to advise your patients to withdraw only, and you just stop all the medication and you don't provide them with any medication for at least 2 or 3 months before you can restart this kind of medication.